Hello everyone, Dr.berkkkaratas. I mentioned earlier that the most common cause of erectile dysfunction is vascular problems. Erectile problems can occur due to insufficient blood flow from the arteries or due to venous leaks. I explained this earlier through graphs. But since the structure of the penis is a bit complex, there might have been some issues in understanding it. That's why I want to explain it in a simpler way. Now think of the penis like a balloon. Let's think of it as air coming in from one side and going out from the other. Let's assume that the air coming in is actually blood. I have been before. I drew this. Now, there can be 5 different situations regarding the erection with the aspect of erection. Now, first of all, if we give our erection a score of 10 out of 10, well, that's especially true when it's as hard as a rock. Let's say that the situation in young people, in children, and in adults is a 10 out of 10. Now, during rest, the blood flow to the penis is 4. The outgoing blood flow is 3. That leaves 1. So, a score of 1 out of 10 means there is an erection, but it's practically non-existent. So, it stays in its normal state. Penis. What does this unit become? Here, a certain amount of blood needs to stay for a while to nourish the tissues. What happens during an erection? The incoming blood flow is increasing, so the arteries are widening. 11 units of blood are coming in. This is where it closes in the veins, meaning in the venous system. From there, 1 unit is leaking out. A total of 10 units are pooling in this area. In the end, we have an erection that scores 10 out of 10. This is the normal mechanism in patients who do not have an erection. So what happens if there's arterial insufficiency? Then the incoming blood flow is not 11 units, but for example, it becomes 6 units. The outgoing blood flow becomes 1 unit. Again, this doesn't change. This is because there is no venous problem. There is no venous leakage. So 6 to 1 is 5, which means a score of 5 out of 10. Indicates that there is an erection problem. We end up with a soft penis that doesn't get very hard. If this is 7, then this number becomes 6. If it's 8, then it becomes 7, and so on. We can say that here the condition changes according to the degree of the artery's ability to bring blood. Venous leakage is very important. There are quite a few questions coming in about this, and we've also received a request for a few videos. Venous leakage incident. It's not in the artery, so the incoming blood is normally coming in at 11 units. But instead of 1 unit of blood going out, for example, 6 units are going out. So it's leaking a lot of blood. The corpora cavernosa can't close properly. So what happens then? Again, it results in a hardness of 5 out of 10. Here, what determines the severity of the situation is the amount of blood coming from the artery. Here, the amount of Ca escaping from the vein determines the severity of the event. If this is 7, then this number will drop to 4. Then there won't be any intercourse. Another situation, in the case of both arterial insufficiency and venous leakage, then the incoming blood was 6. The outgoing blood was 5. It should have been 1, but it was 5. Only 1 is left. Well, there will be no erection. In response to any stimulus, the treatment of this group of patients is quite difficult. In fact, direct protest to this group of patients, treatment is recommended. In this group of patients, the amount of blood coming from the arteries is tried to be increased even more because we don't have much influence over the veins. Here, injection therapy, shockwave therapy, and medication treatments can be applied. This group is the easiest to treat. Arterial insufficiency. Here we have medications, shockwave therapy, PSAT therapy, box therapy, and injection therapy. We can achieve an average success rate of about 80% here. Therefore, as you can see, we have treatment alternatives depending on the situation. Venous leakage is arterial. Unfortunately, with insufficiency, this usually leads to prosthesis. I tried to summarize it this way. I hope I have been helpful. Thank you.